Namaste all. Dr. Anakha, I welcome Dr. Anakha to compare the session.
Thank you, sir. Sir, am I audible?
Yes, you
Yes,
are
yes.
audible.
Okay, thank you, sir. A very warm good evening to everyone. We welcome you all to the live webinar session regarding mental health awareness on the subject Healthy Minds for Nation Building Vision Viksit Bharat at 2047. Today, we will explore the critical role of mental health in fostering a prosperous and harmonious society. We will discuss how mental well being impacts productivity, physical health, education, and social cohesion. Our goal is to highlight effective strategies and policies to promote mental wellness at both individual and community levels. Over the past month, the Viswa Ayurveda Parishad, in association with Aryatara Ayurniketan, has made significant strides in promoting mental health through Ayurveda. Our efforts have reached various segments of society, including teachers, students, professionals, corporate systems, tribal communities, medical professionals, patients, and more. We continue to work with the motto Healthy Minds to Create a Healthy Nation, contributing to the vision of Viksit Bharat 2047. The appreciation from the Honorable Governor of Kerala inspires us to further our noble cause. We are joined by experts who will share valuable insights and practical approaches. Thank you for being here, and let's start our journey towards a healthier, more thriving nation. Let us begin today's session with the blessings of Almighty. I humbly invite Dr. Ankush, State Executive Member, Viswa Ayurveda Parishad, to do the honor.
Namaste, am I audible?
Yes, yes.
Namami Dhanvantarim Adidevam Surasurirvandit Padapatmam Lokirjararupaya Mrityunasham Dhataramisham Vividhaushadhira Om Dham Dhanvantarayen Om Dham Dhanvantarayen Om Dham Dhanvantaraye Namah.
Now, let's welcome Dr. T.T. Krishnakumar, State President, Viswa Ayurveda Parishad, for the welcome speech. Sir, please.
My dear Govind Shuklaji, National President of Viswa Ayurveda Parishad, Dr. BS Prasad, sir, President, Board of Ayurveda NCISM, guest of honor, Dr. Rama Bhatta ji, President, MAR BISM, NCISM, distinguished speakers, Dr. KK Dwivedi ji, Member, Board of Ayurveda NCISM, Dr. Rajini Nair, Member, Board of Ethics and Registration NCISM, Vaidya Vinod Kumar ji, Surendra Chaudhary sir, both National Secretaries, Dr. Arjun Chand C.P, State Vice President, Viswa Ayurveda Parishad, and all other dignitaries and Karyakartas of Viswa Ayurveda Parishad who have joined the session, and the beneficiaries. I think some of the beneficiaries of this project which has been carried out by and is continuing by Dr. C.P. Arjun Chand. They are also present in this session. And I welcome all, Sabhi ko Sadar Namaskar, and I welcome all to this session. That is a great opportunity for us. I think that we are blessed with the presence of such great leaders today, and I wholeheartedly welcome each one of you, one and all. Thank you, sir.
Thank you so much, sir. Next, we have the presidential address. To do the honor, I humbly invite Vaidya Govind Shukla, National President, Viswa Ayurveda Parishad. Sir, please.
यत् प्रभा पट्लोद्भाषी भाषते यद्यापि भारतम आयुर्वेदात्मकम ज्योति शाश्वतम न प्रकाशतम। विकसित भारत और मानसिक स्वास्थ्य, ऐसे एक महत्वपूर्ण विषय पर विश्व आयुर्वेद परिषद केरल इकाई के माध्यम से जो कार्यक्रम किया जा रहा है, उसमें उपस्थित आदरणीय डॉक्टर प्रसाद जी, डॉक्टर रघुराम जी भट्ट, डॉक्टर के द्विवेदी जी, डॉक्टर रजनी नायर, डॉक्टर टी विनोद कुमार जी, डॉक्टर सुरेंद्र जी चौधरी, केरल इकाई के हमारे माननीय अध्यक्ष टी कृष्ण कुमार जी, आदर्श जी और सभी जुड़े हुए कार्यकर्ता बंधु। विकसित भारत की जब हम संकल्पना करते हैं तो निश्चित रूप से मानसिक स्वास्थ्य की अपनी एक महत्वपूर्ण भूमिका है। हमारे ग्रंथों में लिखा है कि सोचानाम सर्वेषाम सत्व शुद्धि विशिष्यते, सोचानाम सर्वेषाम सत्व शुद्धि विशिष्यते। जितनी भी पवित्रताएं हैं, प्रगति के जो मार्ग हैं, उन मार्गों पर बढ़ने के लिए और अंतिम परिणाम तक लक्ष्य प्राप्त करने के लिए सत्व शुद्धि प्रधान है। हमारे यशस्वी पूर्व प्रधानमंत्री अटल बिहारी जी की वो पंक्तियां हैं कि छोटे मन से कोई बड़ा नहीं हो सकता और टूटे मन से कोई खड़ा नहीं हो सकता। जहां पर मन का विषय है, सत्व का विषय है, तो मैं मान के चलता हूं कि भारत की जो हम एक संकल्पना कर रहे हैं, विकसित भारत की जो हमारी एक ध्येय है, उसमें मानसिक स्वास्थ्य की एक महती भूमिका है। चाहे अपने कार्य के दृष्टिकोण से आयुर्वेद की जब बात करते हैं तो आयुर्वेद के माध्यम से, अपने इस विज्ञान के माध्यम से भारत के विकसित होने में क्या भूमिका हो सकती है, उसमें मानसिक स्वास्थ्य का अपना एक बड़ा महत्व है। क्योंकि जब हम बात करते हैं तो मानसिक स्वास्थ्य की बात करते हैं तो उससे आयुर्वेद से बेहतर कहीं पर वो विषय और चिकित्सा के दृष्टिकोण से या मानसिक स्वास्थ्य संरक्षण के दृष्टिकोण से कहीं प्राप्त नहीं हो सकता है। प्रारंभ में हमारा लिखा है कि धी धैर्य आत्मादि विज्ञान मनोदोष औषधम परम। एक सूत्र रूप में जो अष्टांग संग्रह में लिखा है कि धी धैर्य आत्मादि मनोदोष औषधम परम। तो उन विषयों को देख करके, उन विषयों के आधार पर बढ़ते हुए, साथ ही अगर चिकित्सा की बात करें तो सत्वावजय चिकित्सा का एक बहुत बड़ा विषय, बहुत ही प्रासंगिक विषय आयुर्वेद के ग्रंथों में मिलता है। चाहे वो किसी भी प्रकार के सत्वावजय के माध्यम से हो, औषधीय द्रव्यों के माध्यम से हो, या शोधन चिकित्सा की जो हमारे प्रोसीजर हैं, चाहे शिरोधारा है, शिरोबस्ती है, जितने भी हमारे उपक्रम है, वो उपक्रम आज के परिप्रेक्ष्य में जिस प्रकार से मानसिक विकारों की जो एक बढ़ती हुई चेतावनी हमारे सामने है, स्वस्थ समाज के सामने चेतावनी है, और ये चेतावनी निश्चित रूप से मानसिक भावों का जब तक संतुलन नहीं होगा, मानसिक भावों की जब तक वैकारिकी दूर नहीं होगी, वो किस स्तर पर कैसे हो सकती है, उसका एक बड़ा रोड मैप बनना चाहिए। जब हम विकसित भारत 2047 की बात कर रहे हैं तो वहां पर आयुर्वेद की मनोचिकित्सा के दृष्टिकोण से आज प्रसाद जी पूरे देश भर में जो एक बेहतरीन पाठ्यक्रम कि हमारा जो विद्यार्थी है वो कैसा निकलना चाहिए, उसके अंदर किस प्रकार का आत्मविश्वास होना चाहिए। और निश्चित रूप से जब हम क्वालिटी एजुकेशन की बात करते हैं कि विश्वविद्यालयों में और महाविद्यालयों में जब क्वालिटी एजुकेशन की बात करते हैं तो समय पर रिजल्ट का डिक्लेयर होना, समय पर एग्जाम का होना, समय पर अन्य व्यवस्थाएं होना, ये एक एडमिनिस्ट्रेटिव पार्ट है, ये एक प्रशासनिक व्यवस्थाएं हैं। लेकिन जब क्वालिटी एजुकेशन की बात करेंगे तो अपने शास्त्र का गूढ़ अध्ययन और साथ में ही जो समसामयिक विषय हैं, कंटेम्प्रेरी जो नॉलेज है, जो आचार्य सुश्रुत ने भी कहा है कि सतत अध्ययनम वाद परतंत्रावलोकनम, वहां पर सतत अध्ययनम, वहां पर अपने विषय का सतत अध्ययन शब्द प्रयोग किया है, अध्ययन शब्द प्रयोग किया है, और परतंत्रावलोकनम, वहां पर परतंत्र अवलोकन शब्द का प्रयोग किया है। तो निश्चित रूप से जो मन का जो विषय है, इस विषय के माध्यम से ही विकसित भारत 47 की जो बात कर रहे हैं तो उसमें एक महती भूमिका है। जब तक हम चाहे वो मनोविकारों के दृष्टिकोण मन की जब बात करेंगे तो वो एक सामान्य जीवन से लेकर के आज हम बहुत सारे विषयों की बात करते हैं, चाहे वो एथिक्स की बात है, तो उन सब बातों में भी एक मनोभाव की विकृति, जो मन के दोष हैं, काम, क्रोध, लोभ, मोह, मत्सर, जो हम एक परिदृश्य देख रहे हैं, वैकारिक परिदृश्य देख रहे हैं, बिगड़ा हुआ परिदृश्य देख रहे हैं। आज हमारे साथ में एनसीआईएसएम के जो क्वालिटी एजुकेशन को लेकर के काम कर रहे हैं, डॉक्टर प्रसाद जी हैं, डॉक्टर रजनी हैं, डॉक्टर द्विवेदी जी हैं, डॉक्टर रघुराम जी हैं। रघुराम जी जब पूरे कॉलेजेस की गुणवत्ता की बात करते हैं तो वहां पर जो नैतिक रूप से, मनोवैकारिक रूप से जो एक भाव व्याप्त है, उन पर भी हमें काम करना। वो भावों को कैसे हम आयुर्वेद के सिद्धांतों के माध्यम से, सद्वर्त के सिद्धांत के माध्यम से, चिकित्सा के सिद्धांतों के माध्यम से कैसे उनको पुष्ट कर सकते हैं। तो निश्चित रूप से जो केरल इकाई के माध्यम से जो पहल की है, ये पहल और इसके विषय निश्चित रूप से हमारी वहाँ नियंत्रक और नियामक संस्थाओं तक जाएंगे। और निश्चित रूप से अगर विकसित भारत की संकल्पना की जब बात करते हैं तो मानव स्वास्थ्य की पहली बात करनी होगी, और पहली बात में जो आयुर्वेद की भूमिका है उस विषय को लेकर के एक विचार और गहन चिंतन की आवश्यकता है। कैसे इसको हम एक जनसामान्य तक, एक अंत्योदय तक, आखिरी व्यक्ति तक हम उसका मनोवैकारिक भावों को कैसे हम समाप्त कर सकते हैं, उस विषय पर एक गहन चिंतन और आवश्यकता का विषय है। तो ये विषय सारा जो जाएगा निश्चित रूप से इसके परिणाम मिलने वाले हैं, और ये पहली इकाई है, फर्स्ट स्टेप है। मैं समझता हूँ कि मानसिक स्वास्थ्य, चाहे हम शारीरिक स्वास्थ्य की बात करें, लेकिन मानसिक स्वास्थ्य के जो दुष्प्रभाव हैं वो शारीरिक स्वास्थ्य पर नहीं, समाज पर भी उसके जो दूसरे भाव हैं उनके परिणाम देखे जाते हैं, दुष्परिणाम देखे जाते हैं। तो उसमें हम जब स्वस्थ भारत की ओर, सबक विकसित भारत की बात करेंगे तो निश्चित रूप से इसकी बारीकता से इसके जो बिंदु हैं, उसकी चिंतन है, उसको हमें गहनता से विचार करके, और उसको कैसे हम आयुर्वेद का जो मूल विषय है, आयुर्वेद में ये जो विषय है, हम औषधियों की बात करेंगे, बहुत सारी औषधियों को लेकर के जा सकते हैं, लेकिन जो औषधियों का वजन कम करके और जो दूसरे विषय हैं, वो विषय आयुर्वेद में कितने समाविष्ट हैं। हमारे यहाँ पर तो काल भोजनम आरोग्य कराणम, डाइट प्लान करके भोजन की व्यवस्था से रोगों का उपचार है, भोजन की व्यवस्था से सत्व चिकित्सा का उपचार है। तो इन सब विषयों को जो मूल विषय है उनका एक पूरा एक व्यवस्थित प्रोटोकॉल बन करके, और आगे इसको कैसे हम धरातल पर, ग्राउंड लेवल पर वो कैसे ले जा पाएंगे, ये सारा विषय आज के विद्वानों के माध्यम से हमको सुनने को भी मिलेगा, और कैसे इंप्लीमेंट होगा ये भी आगे देखा जाएगा। तो निश्चित रूप से आज की इस इकाई के लिए मैं अपनी जो केरल की इकाई है उसका अभिनंदन करता हूँ। साथ ही आज हमारे जो जुड़े हुए हैं, जो रिसोर्स पर्सन हैं, हमारे वरिष्ठ हैं, सभी सम्माननीय वक्ताओं का मैं हृदय से अभिनंदन करता हूँ, परिषद परिवार की ओर से अभिनंदन करता हूँ। और आज का जो विषय हम सुन रहे हैं, निश्चित रूप से हम, सरकारें अपने स्तर पर काम कर रही है, लेकिन हमारे कार्यकर्ता अपनी क्षमताओं के स्तर पर हम कैसे कैसे काम को कर सकते हैं, कैसे काम को बढ़ा सकते हैं, उस विषय पर एक चिंतन और मंथन की आवश्यकता है। और उसी भाव को लेकर के, उसी लक्ष्य को लेकर के विश्व आयुर्वेद परिषद पूरे देश में अपनी पूरी क्षमताओं के साथ में जिस प्रकार की सरकार की नीतियां हैं, चाहे अभी डॉक्टर राकेश शर्मा जी के साथ में सुरेंद्र चौधरी जी हमारा बैठना हुआ, तो किस प्रकार से उन आपकी जो नीति है, आपकी जो योजनाएं हैं, उनको कैसे हम ग्राउंड लेवल पर जा सके। और निश्चित रूप से जो ऊपर के बैठ करके जो नीति निर्धारण होता है उसमें ग्रास रूट लेवल पर क्या आवश्यकताएं हैं, कैसा चिंतन है, उस विषय को एक योजक की कड़ी के रूप में विश्व आयुर्वेद परिषद अपनाए भूमिका निभा रहा है। तो मैं सभी कार्यकर्ता बंधुओं का भी हृदय से अभिनंदन करता हूँ, स्वागत करता हूँ। थैंक यू, धन्यवाद, नमस्कार।
Thank you so much, sir. Moving on, we have the inaugural address, and today we have an eminent personality with us to do the honor. I invite Dr. Amal S. Babu, State Secretary, Viswa Ayurveda Parishad, Kerala, to introduce this personality for us.
Namaste all. It's my privilege to introduce Dr. BS Prasad sir, President, Board of Ayurveda, for our webinar. Sir has more than 30 years of experience in various fields of Ayurveda research, teaching, medicine, manufacturing, and administration. He serves as the Director, Principal, and Dean of Kerala University, Sri BMK Ayurveda Mahavidyalaya, Belgavi for 15 years since June 2021. Sir received Ayurveda Ratna Award in 2008. Teacher of the Teacher Award.
Dr. Humble, make it very brief. Don't you going on reading all those ones.
Okay, sir. Okay.
Already it is 8:22. Which is okay. Make it very brief.
Okay, sir. And he received the Best Teachers Award for the year 2012-13. And he is the recipient of Best Scientist Award for the year 2018 by Kerala University. It's our privilege to have you in our webinar, sir. So I welcome Dr. BS Prasad, sir, for the inaugural address.
Namaskar and very good evening to all of you.
Good evening, sir.
Dr. Govind Shuklaji and my colleague and my well-wisher, my friend, Dr. Raghuram Bhatt, President, Marbism, and also Dr. Rajin Nair, member of the NCISM, and the Surendra Chaudhary ji, and all other experts and delegates, and all the Ayurveda doctors, Vaidyas, practitioners, teachers, and also students. It's a very nice to hear you, to interact with all of you this evening. Very nice to see almost more than 100 people has already joined. It shows the importance of the topic also. And this Manas Roga, the mental health, is very close to my heart also. I also always like it. In fact, when I joined for my PhD, my first synopsis proposal was on the Manas Roga, where of course my guide not accepted, and then I had to land in Vajikarana by accidentally. That way I gone there. But however, it is very close to me, this topic also. So that way I have developed some interest also. And however, when I see the how it is going on in the present days, and the importance of this also, and how our people are looking to it and then making. Though Manasroga PG has started very long back, still it has not developed very well to the to make a identification as it's a specialty in that one, the society also. It is one of the aspects there. So that was the main major issue, where we thought we have to give a proper identity for it and a shape to it also. Then NCSM has taken initiative in developing DM course in Manasroga. And that time we thought we will close down the MD because it is not giving the desired results. Because everyone is joining in the Kaisikitcha teacher, and so they are not practicing that one. So that way we thought we close this one and we go for the proper way of structured way of the DM course, so that the people start practicing Manasroga medicine. That was our idea. But anyway, there was a lot of opposition was there, and then many people request was there. And of course, all the people has wrote me the scope of the Manasroga, how much scope is there. But my question was, when this much scope is there, why everyone is joining the Kai Chikitsa? That was my question anyway. It was not answered. But our problem came with the Nimhans MD Manasroga. The Nimhans also decided to close down MD Manasroga because of NCSM decisions. Then we rolled back our decision. We retained the MD degree and also started the proposal for DM course also. Shortly, when the PG notification comes there, we may have the DM Manasroga also may be there in that one if everything goes well. That way it is the way. When we come to the practice, many times we have only maybe the Unmada, Pasmatata, Nivesha, very few things will be catch hold going on practicing these ones. And we are not actually going to the every age-wise problems also. Even now gadgets issues are big issues are there. There is a concept called gadget upvas. So pause the gadget for some time, at least for some time. Likewise, the concept is coming up. So children to all age groups, Even the old age people also have problems are there. So we need to identify every age wise problems are there, and we need to address that issue also. Not only the pathological conditions where all these the adjustment problem, personality problems, these all huge issues are there where this Manasroga people has a or the mental health. There is a very important aspect of there in every sector of the people there. That way is having the huge importance there. I hope we have the very good resource persons are there. Dr. K.K. Dwivedi, Vinod Kumar also there, and then even Arjun, who is a very expert. Last Global Ayurveda Festival, I had interacted with him. I was not doing earlier with him, but I interacted. I could able to understand his insight and the interest also in the Manas Roga. He is having the lot of desire and the interest as in-depth understanding also. So they'll definitely enlighten you people all within their the knowledge and the experiences that will be helpful a lot. Even Vivedi, I know very well. Since long time. Even the when PG Manasroga was living very long back, it was the syllabus first time prepared. We were together. We were there in the Sri Ayurvedic College. That time it was prepared. We were together in the same committee. Was there. That way, I know his interest, his experience, his expertise in the respective field. That way, it is there. So this way, NCISM is looking towards this part and to develop it to the DM level so that you will get the identity, you will get the, a proper shape to it, and then able to start implementing the knowledge which has been embedded in the Ayurveda, which in the proper way of spreading. Otherwise, we don't want the getting degree and joining other branch, practicing or teaching the common subjects. It is of the no use, it's not justification there. There is one part which I wanted to inform you also in the concern to mental health or Manas Roga, the NCSM initiatives are there. And another area, and then we, as I told, the NCSM is taking a lot of efforts in capacity building. They were going on doing their teacher training, everything else. And the now the maybe 11th and 12th, they will be holding the Prana. There is a national conference on the rights and the protecting rights and novelties in the ASU systems there. Those who are having the IPRs, intellectual property rights, how to protect the intellectual rights, how to get the patents, how to get the technology transfer, how to commercialize that one. These all things which our people are holding so many patents, so much of knowledge, so much of the IPRs, but we are not able to technology transfer, unable to commercialize that one, or able to patent that one. So these are the issues are there that we identified, and then we are holding the conference. We are already processed the registration of nearly more than 500. 11th and 12th, we are going to host the whole that one with the collaboration of AICTE. That way, we are holding, and these people will be trained in the patenting or commercialization, etc. That may be a very important aspect which NCSM is going to do that one. So this way, in all areas, NCSM is putting efforts, and we are doing the curriculum also, the meaningful way of curriculum we are bringing out, which has given the results, where we can see the first year BMS results, 20% hike in the entire country. We could able to get the results because of the competency-based medical education introduction that way. Likewise, all education reforms we are doing, and recently we have launched, released the minimum essential standards. There also we have taken a lot of care for the all the departments, and the even the Swasthata department. We have given that a task of the even the employees, the institutional employees, students, counseling part also, and also we have mentioned a counselor in every college. That again we have in liquid with the Swasthata people can be the counselors, or Manasroga people can be the counselor in every college, where even the other college the competency we are giving. So where the our Manasroga, the MD people can be a counselors in the as per UGC norms in every college, they have to be have this one, that competency we have attributing to the MD Manasroga people also. This also we are doing that way. So that way, these are the initiatives are definitely going to help a lot, provided the people who are studying in the Manasroga, they come out with the proper way of protocols implementing. As I told, every age people require a proper way of counseling and address the issues are there. So that is the need of the hour. And I request again, like maybe Arjun, etc., those people, they come out with the implementable protocols, not only stick with the therapeutic parts only, those who are having the mental disorders, diseases, treating them only, and again coming to the counseling part, which is the most important part in Ayurveda also. So that is to be taken up very seriously, and to train the people to be in the society and addressing all the society issues there. That is the need of their work. I hope definitely this such conference or meetings or the seminar webinars will definitely help the people to get in that angle, getting the shape else. Once again, I compliment all the people who are involved in arranging such conferences, such meetings or the webinars. I thank for me the organizers for giving me opportunity also. Thank you all. Thank you very much.
Thank you, sir. Your expertise and eloquence were evident, and your ability to convey complex ideas was remarkable. It was an honor to hear from you, sir. Once again, thank you so much. And now I humbly request Dr. Amal S. Babu to step in once again and introduce us another eminent personality in limelight enrolled as today's guest of honor.
Namaste all. It's my privilege to introduce Dr. Raghram Bhatt sir, President Marbism NCISM, for the webinar. He served as the Director of Postgraduate Studies, Professor and HOD of the Department of Deviguna at Susruta Ayurveda Medical College, Bangalore. He graduated from Bharatiyar University, Coimbatore. He secured 5th rank for the state and postgraduate in Dravyaguna from Gujarat Ayurveda University, Jamnagar. It's our privilege to have you in our webinar, sir. And I welcome Dr. Raghram Bhatt sir for the guest of honor.
Respected President of Board of Ayurveda NCISM, Dr. BS Prasad sir, respected President of Viswa Ayurveda Parishad, Vaidya Govinda Shuklaji, other office bearers like Vaidya Surendra Chaudhary ji and K.K. Dwivedi ji of Viswa Ayurveda Parishad. K.K. Dwivedi ji is also the member of Board of Ayurveda, which is a policy making board. Other Viswa Ayurveda Parishad members, well-wishers, Ayurveda Vaidyas, and other listeners of who have joined this webinar. The topic is, of course, I need not talk about the topic because already the previous speakers have spoken regarding the topic and they have told the importance of the topic. But being an office bearer of NCISM, I proudly say that the reforms carried out by NCISM under the able chairmanship of Jayant Dev Pujari ji and the two policy making boards, presidents of two policy making boards, Dr. BS Prasad sir, Dr. Jagannathan sir, and the president of Ethics and Registration Board, NCISM has surged ahead and earned a great reputation all over the country regarding the reforms in Ayush education. Ayush education reforms is very important because the medical assessment and rating board is concerned with the implementation of MSR and MSc. We are actual regulatory board of NCISM. Board of Ayurveda, Board of Unani Siddha Sivarikpar, the policy makers, they bring about the policy, they prepare the MSR, MES, MSc, whatever MESR, which is newly named. And based upon that, according to that, those policies or those rules and regulations are to be implemented. The process of those implementation is to be determined by Medical Assessment and Rating Board. I hope that is a major work of MARB, where we implement the new MSR or MESR, what is told, and the MSE, which is published in 2022. The MESR, newly published MESR, is about the minimum standard requirements which are to be fulfilled 100% hereafter by all the educational institutions of Ayush system. And the other job is based upon the MSc, where the education standard in each and every institution is assessed by the process of rating, which is newly started. The quality of education becomes more important because the assessing the minimum standard requirements were carried out by even CCIM since its beginning. Even now we are doing that. But new thing what is done is the competency-based dynamic curriculum, the beautiful syllabus, well-structured syllabus, well-structured training programs, various training programs for principals, stakeholders, entrepreneurship, and other teachers, and other such training programs, which have created an environment of educational reforms. Not only thinking about infrastructure, manpower, or the facilities. So we have to think beyond that. Infrastructure, manpower, and facilities are basic things which are to be fulfilled. And we have to think beyond that. That is what is the message given by the NCISM. So here, there should be a paradigm shift in the mental health or mental well-being of all the Ayurvedic institutions as well as Ayurvedic fraternity. If you speak about college, if you speak about CCIM or NCISM, it's not about minimum standard requirements or inspection, but educational reforms, quality education. That's why the rating is introduced now. Within 2 months, we will be implementing the rating process. The colleges who are eligible for rating will be intimated soon, and they will be given with the data capture format. They will fill the data, and assessors training is already over. Those trained assessors will be sent to the selected colleges through the QCI, because we are given this job of assessment and rating to the Quality Council of India, which is already expert in all such quality assessments. So here also we are given that job to QCI. So the expert body of the Indian government will conduct this assessment, and once that assessment is conducted, surely there will be a dramatic change in the field of Ayurveda education, and thinking of each and every Ayurveda student, Ayurveda faculty, Ayurveda practitioner should change. That is called the Manasika Chikitsa, which is to be done for the Ayurveda fraternity. When we think positively, when we think that it is possible to treat even not only non-communicable diseases, but communicable diseases or acute diseases or surgical conditions, all the emergency conditions through Ayurveda, and establish Ayurveda as a robust healthcare system which can compete or which can equally render the healthcare facility to the society like the other counterpart, that is allopathy. Then only it is possible that we can bring Ayurveda to the mainstream, and Ayurveda will become the mainstream healthcare system of not only India but all over the world. For that, we have to retrospect ourselves, change our thought process, clean our mind, and do panchakarma chikitsa or shodhana chikitsa to our mind, and enhance, activate the mind and think in a positive way so that we can reach the goal within 2047 as mandated by our Honorable Prime Minister Narendra Modi ji in 2022. Thank you for the organizers for giving me an opportunity to be here and just say a few words to you, and wish you all the best in this webinar, and wish all the best for the speakers as well. And I thank respected Prasad sir for giving such a good oration in this webinar. Thank you, Ananda.
Thank you so much, sir. Your words not only captivated the audience, but also provided valuable perspective that will resonate within us. Once again, thank you so much, sir.
Thank you, sir. Thank you, Raghuram, sir. And thank you, Prasad, sir. I would like to call Dr. Rajini, madam. She is my teacher, to speak a few words in this occasion. Ma'am, please welcome.
Thank you, Arjun. Namaste all. We all know that around India, our Viswa Ayurveda Parishad is conducting various programs like seminars, hands-on workshops, these residential programs, then hands-on training, etc., for upliftment of Ayurveda, as well as to fulfill the vision of Government of India, that is Viksit Bharat at 2047. And as you all know, Dr. Arjun Chand was doing a tremendous job and a miraculous job, that I will say, because he was conducting various programs, that is online, offline counseling, then awareness campaigns to various sectors of persons regarding the mental health care. And he was also appreciated by Honorable Governor of Kerala, Shri Arif Mohammed Khan. Congratulations, Arjun. And regarding this conduction of various programs, as you all know, National Commission of Indian System of Medicine, Ethics and Regulation, Ethics and Registration Regulation 2023, which was published on December 2023, we made it mandatory that for renewing the registration, each and every practitioner should complete or should accrue 50 credit points through continuous medical education. Continuous medical education includes seminars, workshop, hands-on training, then residential workshops, etc. Even patent, we have included that one. A detailed guideline regarding that one will be published soon. So such type of initiative from Viswa Ayurveda Parishad, it is a remarkable one. And we are actually blessed today of having with us the dignitaries like Chaudhary ji, Govind Shukla ji, Hamara Prasad sir, Raghuram Bhatt sir, Vinod ji, Divedi ji, etc. So I wish all the Karyakartas of this seminar, especially the Viswa Ayurveda Parishad Kerala, a wonderful to have a wonderful seminar, and I also congratulate them to taking up this subject and for conducting such a webinar. Thank you all.
Thank you so much, ma'am. Now, it's time for our distinguished speakers to showcase their vibrant knowledge with us regarding healthy minds for nation building Vision Viksit Bharat at 2047. For the smooth and timely conduct of the program, we kindly request our speakers to remain in a time limit of 10 minutes. First and foremost, let us give a warm welcome to Dr. K.K. Dwivedi, Member, Board of Ayurveda, NCISM, to present the topic, Need of Ayurvedic Psychiatry in Academic Sector.
Respected Professor Prasad sir, Professor Raghuram Bhatt ji, Professor Govind Shukla ji, Professor Rajni Nair ji, and other eminent speakers of today, the office bearers like Govind Shukla ji, Chaudhary ji, and others, and whole web team from Kerala and Aryatara Ayurniketan team. It is a very important meeting or workshop. What we can say that we are here. And first of all, I must congratulate Dr. Arjun Chand ji for his untiring efforts to promote mental health for last 1 month. As Ayurveda at 2047 was launched by team of Viswa Ayurveda Parishad 2 years back. And in continuation of that, we are working, and it is one part that is healthy minds for a healthy nation. That is Vision Viksit Bharat 2047. We all are aware that we cannot differentiate between the physical and mental parts of any patient. So it was described in Ayurveda as an integral part, but due to time demand, we have separated Manas Rog with physical illness or physical diseases. Although we have produced 700 graduates MD Ayurveda in Manas Rog and Mano Vigyan, but Dr. Prasad has indicated that we are not practicing most of them. Very few people are here who are doing practice of Manas Rog. So it was a concern which was directed by Prasad sir. When we talk about the need of Ayurvedic psychiatry in academic sector, we all are aware with the side effects of modern medicine. But there is significant benefits also, which I want to highlight. When we go through the treatment part, we usually talks about 3 types of chikitsa, that is called Daya-Vipasya chikitsa, Yukti-Vipasya, and Sattva-Vajay. You see here, when I want to categorize it, I say that Daya-Vipasya chikitsa is mostly preventive. Yukti-Vipasya chikitsa is for the patient condition, and Sattva-Vajay is the part of after that. But when we consider, apart from the Yukti-Vipasya chikitsa, Daya-Vipasya chikitsa, and Sattva-Vajay, we are not practicing it, but which is the integral part to treat the mental health. That should be introduced thoroughly in our curricula or in our practice. The holistic approach to mental health, which usually considers the physical, mental, and spiritual well-being, but not in the modern psychiatry. We usually consider all these aspects. And also we have historical and cultural significance that is deep-rooted in Indian culture and history. And that is more towards for the prevention of the mental illness. Ayurvedic psychiatry offers a various alternative therapies such as meditation, we can say the yoga, the dietary recommendations, all these should be considered. The potentially reducing the reliance on pharmacological interventions are very important to think about that. And when we are treating the patients, the personalized medicine, what we say, that is prakriti based or constitution based, that we should keep it in mind. We never goes through the, when we are treating a patient of psychiatry, 16 types of manas prakritis, which actually reflects different type of personalities. And I also think that integration and of modern medicine and Ayurvedic psychiatry is important because it leads to the innovative treatment protocols that can leverage the strengths of both the system. What are the good things in our system, and what is good in the modern system or in other system of medicine? That should be taken, and the one integrated approach should be made to the patient. Regarding research and development, if we say, it encourages research into its methods and efficacy, leads to the evidence-based validation of Ayurvedic practices, facilitating their acceptance and integration into mainstream of medicine. Global health perspective, if we see, its exposure to Ayurvedic psychiatry will enrich the global perspective of the medical students and professionals, fostering an appreciation for different health system and practice worldwide. Our preventive part, that is Ayurvedic psychiatry, places a strong emphasis on prevention, care, and lifestyle management, which can be crucial in preventing mental health disorders. Teaching these principles can empower individuals to maintain mental wellness practically. The educational diversion is also one important factor, including Ayurvedic psychiatry add to the diversity of medical education, offering students a wide range of knowledge and skills. This diversity can enhance critical thinking and problem-solving abilities by exposing students to various medical paradigms. When we are doing practice in our OPDs, we are almost leaving all this, the part of sattva, mana. We are not considering all these things. We are only going through that, and we have a limited scope. What we say, that is the chapter of Unmad, Apasamar, Atatva, Bhinivit, etc. But the total Ayurveda cannot be separated with the physical and mental parts. Although there is a gap in addressing mental health at the global level, but integration of Ayurvedic psychiatry into academic sector can enrich medical education, which can promote a holistic approach to mental health and foster a more comprehensive part of that. I think we have to rethink about the approach to the modern psychiatry or Ayurvedic psychiatry. We can plan of that, but this is my sincere request. Although the NCISM is working and approaching to increase the knowledge training of the Ayurvedic psychiatry practitioners, teachers, researchers, but this is also our duty. Approximately 5 to 6 colleges who are offering postgraduate degrees in different parts of India, and approximately more than 600 to 700 people are now well versed with Ayurvedic psychiatry. Due to any reason, we are not able to do practice due to lack of confidence or due to lack of some other thing. I hope such type of workshop, all these practices will enrich our Ayurvedic psychiatry. And that again, I am thankful to the team Kerala for this, their effort. And thank you again. Thank you to all. Thank you.
That was an enlightening session. Thank you so much, sir. Moving on, next we have Vaidya Vinod Kumar PG, Senior Scientist, TBGRI, and the National Secretary of Viswa Ayurveda Parishad, to present the topic, Scope of Ayurveda Psychiatry in National Building. Sir, please.
Nation building. Namaste and thank you, dear Aneka, and Namaste Prasad ji, Raghuram Bhatt ji, Dr. Rajini Nair, particularly Govind Shukla ji, Namaste, and Dr. Divedi ji, and everyone who have assembled, and all the, I think there are so many luminaries I can see, who have joined, and many students as well. And it is indeed a great honor for Viswa Ayurveda Parishad in particular to have embarked on a huge journey of Manasika Roga in particular. It is a very seldom this particular topic is taken into consideration, when we talk about Ayurveda and its gamuts, because usually it is a Yukti Vyapasraya Chikitsa, which we are all, concerned about, which we are all usually, we are working on. But this is indeed a great moment, particularly for Viswa Ayurveda Parishad. I should, start with saying we don't have to say thank you, but Dhanyavad ji, particular to Dr. Arjun Chand. Behind every man, there is a woman. So Dr. Arya Krishnan, who is behind Dr. Arjun Chand, and I think they have, very solidly they have done, this particular work, which it has been going on for years. But this particular month of this mind to tackle the manas and associated problems, they have embarked on a huge journey, and it was very well congratulated, as Dr. Rajini said, by the Hon'ble Governor of Kerala. So that is, he has even, I think that video is there for you to see. So this is one a huge moment for Viswa Ayurveda Parishad in a way. Why I want to say is that why we have taken up this topic now. See, it is a least attempted or least cared, or what we have not really cashed on it. For example, the soft power. Every country has a soft power. In Bharata has shown the soft power of yoga to the whole world, and see what has happened to the yoga, which is being practiced in more than 150 countries, and by the honorable, our Prime Minister, who was pioneer behind making it an International Day of Yoga, which has gone far and wide. But I tell you, 99% of the trade related to yoga is managed by the Europe and US. Less than 1% is by Bharata. So this is where Prime Minister himself had told Dr. Sri P.R. Krishnakumarji, unfortunately, who is no more, and P.R. Krishnakumarji told me, when I asked him, why don't you tell our Honorable PM to make International Day of Ayurveda, then PM, Modi ji said, first of all, you make your house in order. We saw what happened to yoga, which is, we have made it international, but at the same time, it is hardly visible within Bharata to the extent that is needed actually. So we have to work. So first of all, we have to make our house in order. So as part of the nation building, restructuring of Bharata that is happening now for the past 10 years or so, and which will continue. And, we have to have this Ayurveda as a whole, but without manas, there is no shariram. And without manas and shariram, and without atma, there is no, there is absolutely no importance for mind even. So Atma, we have not reached to that stage. Deva Vipasraya has not even reached, we are not reached, because we are still, what I call will be, what I tell is, we still have this colonized psyche. Till the West, we have to, the Western science or Western Europe, they have to tell us, hey, there is something in the mind in your Shastra, in your science, and then only we will wake up. As Prasadji rightly said, there are 250 odd, as I was told, MD in Manasika Roga. How many of them are practicing? That's a very good question that he asked. And fortunately, we are happy to hear him saying that the Swastavrta people in particular, of if at all there is a Manasika Roga MD in the college, they will be a counselor. They will do the counseling. Sir, thank you so much for doing such a great thing. I think that will be a starting point for the Manasika Roga experts in our colleges. That's a very important thing. At the same time, let me tell you, this is a soft power. Manasika Roga is, I think, Manas, Manovijnan, and the ability to treat and cure Manasika Roga is actually a soft power of Bharata. So this actually, we have to cash on it. See, the WHO has said more than 50%. It was 40%. Now it has gone up to 60%, around 60% after the COVID-19. Because there are a lot of depression, anxiety, neurosis, and particularly insomnia affected diseases all over the world. Even we get a few patients even from abroad who are having these mental diseases. So imagine the amount of the patients in particular who are there all over the world seeking cure for their mental diseases. As you very well know, I was just referring to, I just wanted to see what is happening the latest in Western science regarding mind. I'll read quickly. In Western science, the mind is generally understood as a set of cognitive faculties that enables consciousness, perception, thinking, judgment, and memory. It is associated with the brain's function and encompasses a wide range of mental processes and states which include consciousness, perception, thinking, judgment, memory. The study of the mind intersects various disciplines such as psychology, neuroscience, cognitive science, and philosophy. In neuroscience, the mind is often seen in terms of brain activity. Come on, they're only considered this as a brain activity, which we have, dhi, dhridi, smriti, and all, of variations of mind, sattva, rajas, and tamas, and all these ramifications which are not found in the Western concept of mind. Mind is often seen as a brain activity, neural networks, and biochemical processes. Cognitive science investigates the computational aspects of mental functions, and psychology examines behavioral and mental processes through empirical studies. Overall, the mind is considered as an emergent property of the brain's complex interactions and functions, yet it remains, listen carefully, deeply nuanced and multifaceted concept that is still under extensive research and exploration. This is what I just spoke is the latest what is happening in neuroscience in the world. Latest what is happening in neuroscience. As you know, the latest neuroscience knows only 10% of the brain. Still, the 90% of the brain is still unknown to the most modern neuroscience. Come on, we have gone beyond the mind. We have gone to the Atman level. Without the Atma, mind is actually the private secretary to the soul, I usually tell. So without the Atman, there is no role for the mind. And the Western science has not reached even to it has not been able to completely define mind even, and work on the mind, various, not only the problems, but even mental health of the mind is still very far away. So this is where Bharata as a nation has a big role to play, a huge role to play. And who will do that particular work? The Ayurveda Mandala or Ayurveda Acharyas and the Ayurveda fraternity has to do that. Ayurveda community has to come forward and to tell to the whole world. First of all, we have to tell to the Bharata, it should reach the nook and corner of Bharata that, in Ayurveda, Manas has been given a very high stage. My Gurunathan used to tell that, why psychiatry did not develop as a system of medicine in Bharata is probably because our Acharyas, they didn't stop at the level of mind, but they went beyond the mind to the soul level, to the Atman level. So they didn't stop at the level of mind. If you see the modern psychiatry, most of the Freudian and Jung theories have been outdated now. It is outdated. And if psychiatry developed as a system of medicine in Europe only in 1920s. And it has been in existence in this Bharata from thousands of years. We have seen a huge COVID here, and what happened to what the contribution made by Ayurveda towards this. I can tell you that there's a huge disaster in the offing, not only in Bharata but in the whole world, in terms of psychiatric problems. Do you know that at least 900 people, 390 plus people out of 1,000 in Bharata are affected with one or other psychiatric problems. Nearly 197 million people in the world are affected by major psychiatric disorders, for which around 70 to 80%, if I read it correctly, for which there is absolutely no cure even. If you see Prozac, which is a only drug, which is we can't expect that to cure the whole diseases of psychiatric diseases of the world. And this is where we as an Ayurveda fraternity, we should showcase Manovijnan, not only Manasika Rogas in particular, but Manovijnan as a whole to the entire Bharata, by contributing in whatever way we can. So let us start with every Kerala model can be a very good model. Dr. Parvati, who was a superintendent of the only Ayurveda government hospital in Bharata. Can you imagine? There is only one government Ayurveda hospital exclusively dedicated to Manasika Roga in Bharata. That is in Kerala. So, and the undergraduate level, if you look, it is hardly studied about Manovijnan. They just read through and it goes. It is not enough. Like Prasadji said, every college in Bharata should have an OP outlet of exclusively Manasika Roga. It should have. It should have. And department, of course, even I do say that there should be a department of Manasika Roga in every Ayurveda college. It is need of the hour. It should start straight away. And that is absolutely needed, because this is a huge area where we can contribute. This is the soft power of Bharata. We don't have to be told by the West, come on, we need to start. We need to start it straight away. We have to have it now. And I tell the youngsters who are in this particular, this webinar, please, study deeply into the Manovijnan, Manas, and Atman in particular, of of what is told in Bharatiya Shastras in detail, so that you can become great psychiatrists of tomorrow. And I'm sure Dr. Arjun and his team will continue to do this particular work. And I want this to reach, or Viswa Ayurveda Parishad as a whole, we want this to reach to the whole of Bharata, not only restricted to Kerala, but to the whole of Bharata. With these few, I think I've taken more time, sorry. But I would like to again stress that for nation building, we have to stress on the Manasika Roga, Manovijnan, and particular at the grassroots. Dhanyavad. Jai Hind.
That was an edifying session with immense clarity on the topic scope of Ayurveda psychiatry. Thank you so much, sir. Saving one of the best for the last, now we have Dr. Arjun Chand C.P, the State Vice President, Viswa Ayurveda Parishad, to present the topic Activities of Viswa Ayurveda Parishad on Mental Health Awareness Month, Future Training Programs on Ayurvedic Psychiatry. So,
Thank you.
please.
Thank you, Dr. Anaka. Am I audible? The screen is visible, I think. Dr. Anaka, is it okay?
Yes, sir.
Yes. Okay.
Thank you. I'm very delighted to listen the words from eminent personalities in India, from India, all over the India, that is from NCISM and Viswa Ayurveda Parishad national level. it was a very great struggle. It was a very much struggle to do all these things, but we did more than 60 to 20 activities in a single month, and we wish to continue these activities for the next one more year. My duty and my role is to introduce you the activities what we have conducted in this 1 month, and we would like to have the help and support from all of you to continue this journey for the next year. 1 year plan is also is being to be introduced here. I request the presence, help, and support from all of you in these activities. I thank Prasad sir, Raghuram sir, Rajini madam, Dwivedi ji, Vinod ji for the supports and supporting words. These are the activities. This is why Viswa Ayurveda Parishad. Why Viswa Ayurveda Parishad? It's the largest organization, as you know, and this organization contributed the leaders and policy makers, extending the activity for the propagation of Ayurveda and making the benefits to Ayurveda community and society as well. So Ayurveda Ayurniketan is working, focusing on mental well-being and propagating Ayurveda psychiatry. So together we contributed this work in this month of May, Mental Health Awareness Month. Sorry for technical. This vision Viksit Bharat 2047, if we want to contribute to this Viksit Bharat vision, we should have the healthy minds, because irritated mind cannot be productive in this nation. So for the completion of this vision Viksit Bharat, we need to have a group of healthy minds, a group of people with healthy minds. The young people, the young energy should be contributed to the nation for the nation building, and then thereby the contributing to the vision of our Honorable Prime Minister Viksit Bharat 2047. I would like to share the few activities what we have done in this month of May. Every day a single message regarding the mental health, it was circulated to thousands of people, general public, for regarding the family health, social health, and mental health, so that they can be they can understand the idea of mental health, and so they can apply in their life. Next, free yoga sessions conducted throughout the month, training program, yoga training sessions, free psychiatric consultations, Ayurvedic medicines were given, free Sattva sessions, Ayurveda psychotherapy sessions were conducted, free lifestyle consultation, how to modify the lifestyle uh, to be healthy and to be productive to the nation. Training for medical professionals, we have conducted a national level training program for mental health professionals on mental health and on the treatment of Ayurvedic treatment of mental health, mental diseases, Ayurvedic understanding of mind. All these matters included in this training program, and few people they have contacted me, and they did their own sessions to contribute the mental health in their own places. The transformation program for public, the knowledge is available everywhere, but the transformation from the knowledge is very important. So we conducted the transformation programs. We introduced the knowledge and how to apply the knowledge in their life. The modified tailored version we have introduced to the public and different people, different categories, and thereby transforming their life into a happy and healthy life. I published an interview of a disease survivor, and we think we have everything in our life, but we are not happy. Many people, as Vinodji told, there is a publication indexed in PubMed. It shows 9 to 37% of people are unhappy or psychologically not healthy in India. 37% is a huge number. So we have to make them happy, or we have to make them mentally healthy by giving such examples of survivors. They, with many problems, many issues, they overcome those issues, and they spend their they're living a good life. So such examples we have given to the public for this, and public published interview with experts psychiatry. More than 30 years of experience in psychiatry, Dr. Abdul Bari, we have done an interview in three episodes. We have recorded the interview, and we have published in the public platform for reducing the social stigma on mental health, to make them aware what are the treatments available, to make them aware where to do and where not to do. These things we have done. Then on Mother's Day, mental health of mothers, very important area. We have done a program for mothers, exclusively for mothers, how they can improve their mental health, thereby improving the mental health of a future generation. That was the aim. And faculty development program for teachers of professional colleges and professional engineering colleges. We have conducted a program for happy workspace. They should be happy. The teachers should be happy to create the good students, or to produce the good professionals in the society. And corporate wellness programs in Adani Port, Vizhinjam. As a part of their wellness series, we have introduced the Ayurveda psychiatry, Ayurvedic lifestyle management to be healthy and to contribute their company, and thereby to contribute our nation. Self-development program in the tribal community. It was the great experience to visit the forests in Kotur, almost 10 kilometers deep to the forest. It was very difficult and adventurous travel during the rainy time also. But we reached there. As Vinod sir told, every man, there is success of every man, there is a woman behind. Me with a family, my wife and a 5-year-old child, we visited this forest, and one day we spent the time with those people and addressed the issues of the people, what they are facing regarding the education, regarding the social interactions, regarding the substance abuses. Everything were discussed, family problems discussed, and we have started doing some solutions, and we offered that we will continue visiting there to address their problem, and they are very happy. This was a very great program, and we are very happy after visiting this community, and we got offered to do in Kotur and another place, and Attapadi forest, and we will go and we will do our best in those community also. Kids happiness program for primary school and pre-primary school children. Women's wellness awareness programs conducted. Science to spirituality, we have conducted a program to a group of people who is interested in spirituality, and the spirituality should not go beyond, or should not go without accepting the science in society. So the scientific part, how the spiritual person, how the spiritual thoughts can be made useful for the healthy minds and healthy body, that was discussed in that session. And as everyone mentioned here, we got a very good opportunity. We got an appreciation from Honorable Governor of Kerala on this.
Ayurveda Parishad
We can listen few things,
has been
few words from him.
highlighting the idea of healthy minds for nation building vision 2047 in association with Aryatara Ayurniketan. I compliment Dr. Arjun Chand C.P. and his colleagues for this endeavor and wish the program all success.
We will share this in the Viswa Ayurveda Parishad platform channel, in YouTube channel also. 4 minutes video, just highlight part I have shown here. This kind of appreciations from eminent personalities fuels our journey and motivate us to do much. These are the outcomes, expected outcomes and achieved outcomes. Increased awareness of mental health and mental health issues, and its Ayurvedic approaches for the mental wellness to the public, and improved access to Ayurvedic consultations and treatments for common mental illness. People are not aware that there is treatment for mental disorders in Ayurveda. These programs created an awareness to the public to in showing there is a treatment for mental well-being and mental illnesses. Enhance the capacity of Ayush practitioners, and we are continuing this capacity building program. We are planning to continue the program. Ayush practitioners, especially the practitioners, should be happy and healthy, and they should be self-motivated to do the motivation to the society. So Ayush practitioners addressing the psychiatric, how they can address the psychiatric illness, how they can understand these issues, how to be dealt with these problems. That programs we conducted, and we will continue this program throughout throughout India, and empower the individuals with the yoga, meditation, lifestyle modification for mental well-being. These all tools are used to uplift ourselves. Once the individual is uplifted, the society will be uplifted, thereby the nation will be uplifted. This is the aim of our program, and establishment of a network of trained Ayush professionals, and throughout the nation, so that they can implement at their own unit levels. So it will be spread. The idea will be spread, not a single person or not from Viswa Ayurveda Parishad Kerala alone, but Viswa Ayurveda Parishad all over India can create small units, and they can propagate the idea, and we can guide and support when and wherever it is required. Enhance the quality of life through improving the mental health, and thereby improving the productivity of nation. Without improving the mental health, which is very hard to achieve the productivity of nation, and thereby achieving the vision of Viksit Bharat. Future planning programs for the coming year. Community engagement, peer group supports are a very good idea to implement the mental health programs, facilitate within the group, supportive relationship from the group. We can create the group, and we can support them from their group members. Community dialogues regarding the from the people, eminent personalities of different communities, different political parties, like that. From them we can continue, we can convey these messages, so that it will reach to ground level very easily. Support and resources we can provide. Helpline supports we can give. Resource fairs we can conduct. Resource fairs from where the public can receive the help and support from different organizations in a institutional level or in a scientific way. And online initiatives, virtual support groups and virtual interactive programs, AI platform. We can, if possible, we can introduce webinars. We will continue with the webinars to spread this vision of mental health, Viksit Bharat, to the vision of mental health 2047. In person, if events we can conduct, if we can increase the resource persons by conducting the programs in among Ayush practitioners, we can increase the number of resource persons, so that we can approach, we can reach to one-to-one persons, one-to-one interactions. We can do in person events we can conduct in different parts of India. That will be a very effective part in this journey. And collaborative effort with the education institutions, common leaders, organizations, healthcare professionals, providers, and stakeholders. We should reach to them. We will reach to them, and we will provide the guidelines to how to address these issues. And if it is manageable in their level, we can manage at that level. Otherwise, we can reach to this expert. They can guide. They can refer them to the experts. We can identify the experts in different part of India, so that we can make a collaborative effort among this society and these people. Target outreach, the different small communities, small unit, like a differently able population in, and youth, a separate population, senior citizen, LGBTQ differently to be, they should be addressed differently, veterans and culturally diverse the communities. We should reach in each groups, and we should tailor our approach for them. That is the idea to propagate this Ayurveda. Creative workshop we have to do. Creative arts, creative workshop we have to do. Poetry, the presentations, this posters, everything we can do, and so that it will be reached. The idea will be reached to the ground level. And community arts project. Arts cannot be separated from mental health. Different people are interested in different arts. So different arts forms can be utilized to improve their mental health, improve the productivity. That is what we have to do. We can do. At last but not the least, very important area, spiritual activities, but it may not get much appreciation or much acceptance from the society, may not be there, but it is very important. As Vinodji told, Ayurveda consider Atma along with mind, the activities along with mind. So spiritual knowledge, spiritual activities should be in connection, collaborated with the mental health activities, so that we will definitely we will achieve the vision of our Prime Minister, Viksit Bharat 2047. Each the contribution from each of us is very valuable. We should contribute our own, as we did in 1 month. We could did this much things. So each of you, each of us can contribute this nation to Viksit Bharat Vision Ayurveda 2047, healthy minds for healthy nation. Thank you all. Thank you for the patient listening.
Thank you, sir. Let us hope that the hard work pays off on a very large scale. Wishing all the success for all the programs of Viswa Ayurveda Parishad. Once again, thank you so much, sir. Now, let us welcome Dr. Surendra Chowdhury, National Secretary of Viswa Ayurveda Parishad, to speak up a few words. Sir, please.
Thank you very much for inviting me. And I can just say that really it's wonderful that a person, if he wants to do something for the society, so he can do in such a extent that the impact can be noticed even in the far away in the forest itself. So all the kudos to Dr. Arjun for such a recommendable and beautiful service to the society. I can extend, I just want to extend my heartfelt congratulations to the entire VAP Kerala team to conduct such type of wonderful programs. I attended few of the programs conducted by Dr. Arjun. He's such a nice guy. And this is the unfortunate part about our country, that a large number of population, they hide their mental status. They never disclose that it may be a disease. We are suffering in that way. While in developing countries, everywhere, in institutions, in corporate offices, there is a mandatory post of counselors. But the country like India, where such type of ailments are not supposed to be the disease, and Ayurveda can play a bigger role. In my personal capacity, being in practice, particularly in government job, where poor or all sorts of economic background people, they came to the for the treatment. So by touching the patient, they start weeping. This is the actual condition, how the population is being affected by emotional breakouts or stresses. So Viswa Ayurveda Parishad Kerala's initiative, I think, Dr. Arjun, I request you to draft a protocol, and we can ask our state units to implement that protocol in ditto without any change. So like that, we can spread your wisdom to other part of the country through Viswa Ayurveda Parishad. And I request, or I will humbly request to the office bearer of the NCISM, both the president of the boards, Dr. Dwivedi ji, Dr. Rajni Nair, that the practicing Manas Rog should be mandatory in each and every Ayurvedic colleges, particularly for the first year students, because they are really in such a stress condition, and Ayurveda can provide them the really needed relief. Again, I'm really thankful that I'm the part of this wonderful deliberations, and congratulate to the entire team of Kerala VAP. And I would like to say that when we browse the attendees, there are a lot of participants from the different part, even from Uttar Pradesh, Bihar, Rajasthan, Haryana, Karnataka, everywhere. So by all practical purposes, a very successful webinar, very wonderful deliberations, and thank you very much for conducting such type of webinars. Thanks a lot.
Thank you, sir. Thank you. Dr. Anaka, we can move on to the next session.
Hello, sir.
Yeah, Anaka, please.
Dr. Anaka.
Yes, sir.
Next is sort of thanks. I think you can just introduce him.
Yeah, it's fine. I think some technical issues. So myself, Dr. Adarsh, General Secretary of Viswa Ayurveda Parishad, Kerala. I take this opportunity. I feel very proud and honored to be part of this organizing the event of this webinar. So first of all, I thank all our dignitaries who have joined here. We know very well that as Ayurveda doctors, we have great thing to contribute to the mental health of our citizens. As Dr. Keshav Balram Gyavaji have conveyed, he is one of the greatest social reformer who have witnessed in this 20th century. As he have conveyed, physical and mental strength is needed for for the citizens, for making our nation a Vishwaguru, or as to make our nation a Paramavaiva Rashtra. So we Ayurveda can contribute many things. Our state vice president and Dr. Arya under the banner of Viswa Ayurveda Parishad and Aryatara Ayurniketan have proved us that we can contribute many things to the mental health, strengthening the mental health of our citizens. So first of all, I thank all the dignitaries, our BS Prasad sir, President Board of Ayurveda NCISM, and Dr. Raghuram Bhattji, President Marbism NCISM. With wholehearted supported, they accepted our invitation a very short notice, and even in their busy schedule, they came and blessed us with their few words. It's really a morale boosting for all Karyakartas of Viswa Ayurveda Parishad Kerala. From the bottom of my heart and from bottom of our Viswa Ayurveda Parishad Kerala's team, we thank you, Dr. BS Prasad ji and Dr. Raghuram Bhattji, for being with us. And our backbone, Sri Govind Shukla ji, our national president, Viswa Ayurveda Parishad, who always supporting us in every activities of Viswa Ayurveda Parishad Kerala. He also was present, and he motivated us like anything. So thank you, Govind Shukla ji, and our beloved Dr. KK Divedi ji, member Board of Ayurveda NCISM, national, also the national joint organizing secretary of our Viswa Ayurveda Parishad. He is also our backbone. He was the main person who have initiated for starting a Viswa Ayurveda Parishad in Kerala with our senior Karyakartas of Arogya Bharati and Sangha activities. And thank you, Dr. KK Divedi ji, for being with us. And our Dr. Rajani madam, she also was in a short notice. She also came up with us, and she also blessed us with a few words. Thank you, Rajani madam. And our Surendra Chaudhary ji, our national secretary, and he is also in a short notice. He also joined with us and conveyed our wishes and improved. He also suggested a great suggestion to how to implement these activities in the other states also. So thank you, Surendra ji, from our bottom of the heart. Also our Vaidya Vinod Kumar ji, he is no need to thank officially Vinod ji, because he is the person who plans and executes everything, and he is the person who is our main Margadarshak, along with our Dr. Radhakrishnan ji, our state Arogya Bharati president. He is also with us in this meeting. Also, I thank our Dr. T.T. Krishna Kumar ji, our state president, also for actively
involving and coordinating our activities in our state. I also thank each and every participants in this webinar who have joined in large number. And once again, I convey that Viswa Ayurveda Parishad activities will not be limited in our just webinars. We ensure that future activities will be done. And as Dr. Arjun Chand C.P have told, the targets and the achievements and the futures are under, so we will be all together as working as a team to enhance the mental ability and reach Ayurveda to each person across our state. Thank you. Dhanyawad.
That was Dr. Adarsh C. Ravi, State General Secretary, Viswa Ayurveda Parishad, delivering the vote of thanks. Thank you so much, sir. Now, let us invite Dr. Arya Krishnan, physician of Aryatara Ayurniketan, who is also the member of Viswa Ayurveda Parishad Kerala, to recite the Shanti Mantra.
ॐ सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्तिः स्वस्ति प्रजाभ्यां परिपालयन्तां न्यायेन मार्गेण महिं महिष गोब्राह्मणेभ्यः शुभमस्तु नित्यम् लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु.
Thank you, ma'am. With this, we have came to an end of today's session. Thank you all for joining today's webinar on Healthy Minds for Nation Building, Vision Viksit Bharat at 2047. We believe we have highlighted the vital role mental health plays in creating a productive and resilient society. By fostering awareness, reducing stigma, and ensuring access to mental health resources, we can build a stronger, healthier nation. Let's take these insights forward and continue our efforts to prioritize mental well-being in our communities. Together, we can make a meaningful impact. Thank you once again for your participation and commitment to this important cause. A warm good night to everyone. Thank you.
Thank you all.
Thank you, Adarsh ji.
Thank you,
बहुत
Dr.
बढ़िया.
Arjun.
Ram sir.
Approximately
Dr. Arjun.
Thank you,
You are doing
40%
very wonderful job.
people couldn't join.
Ram sir. Ram sir.
Thank you, sir.
Namaste.
Thank you.
Arjun ji, very, very
Arjun ji.
congrats and thanks and
Arjun ji.
regards.
हाँ
Thank you, sir. Thank you.
बहुत बढ़िया.
हाँ अर्जुन जी, you are doing wonderful work, remarkable work.
Thank you. Thank
और
you.
जैसा
Thank you.
चौधरी जी ने कहा ना, इस आपके ड्राफ्ट को भेजिएगा, इसको पूरे देश में अपने को परिषद के माध्यम से लागू करना है. वंडरफुल वर्क. थैंक यू.
Thank you. Thank you, sir.
और
Thank you.